if you just look across Africa as well, just to add to that, is that within the medical device space, there is no medical device regulation across the whole of Africa. So for us to promote and advocate regulation within M-Health is somewhat fanciful if it doesn't exist or hasn't existed for the last 50 or 100 years. And they haven't seemed to get that right in the medical device space across somewhere like Africa. Guillaume, I'm moving on because of time.
Right.
There's a big conversation there I don't want to get into on regulation.
Well, there is
So you're about to jump on me, Elaine.
Jump on you afterwards.
Yeah. So we talk about evidence, we talk about design, regulation. Even if we can prove that a POC can deliver the same or better service at a dramatically reduced price, let's say, again, for the example, the quantitative omega CD4 diagnostic comes in at around 1/10 of the traditional price of a CD4 test when you consider the total price. Even that is not strong enough to motivate the government then include that into their fiscal budgets, is it? I mean, just tell us some of the experience that you've had trying to motivate to local governments.
Yeah, thanks for the question. I think the buy-in of the government is definitely one of the main points that is difficult to address, at least from our end. We're having difficulties. I think I can say we've been, for example, working in Burkina for 25 years, so we have a very good relationship with the different government bodies, but ultimately, it's not only about, convincing them to spend $100 extra on a health worker, but it's also about changing the way people work, and that's also some sort of mental change that we need to be able to bring slowly. Also, I think there is a, and again, I'm speaking mostly from my experience in Burkina, but for a government to accept this, there is definitely, you can come up with the evidence, you can come up with the cost analysis, and even make projections that if you scale that up to, I don't know, 25 or 30% of your country, it will cost you that amount of money. But then at the end of the day, there is a question of political will, which you don't always have a hand on, right? Burkina 2 weeks ago, the government was overthrown by a popular uprising. So right now we're in a transition phase. We could have the best evidence, everything that we want, and it's not gonna happen soon, right? So that's also something to take into consideration. Also, I think that for governments to adopt, there needs to be an understanding, and I think maybe there is some sort of maybe on our side misunderstanding that technology, and we see laptops and smartphones and tablets changing every day. So we think we can bring solutions and it will be adopted right away. But actually, to make this a sustainable and a long-lasting tool for a government, it takes a lot of time. So we started our project 4 years ago, and we were looking at 4 more years before we can actually say, okay, that's the scale-up plan for national scale, right? So that's an 8-year thing. And in 8 years, the tablets we had 8 years ago and the ones we have now are completely different. So the technology moves very fast, but the use of technology in this environment is much slower, actually. The adoption is much slower. Another thing that we found that was difficult for us to work with government was that you work with them, you are part of all of these workshops, but their ability or the capacity to actually coordinate and synchronize all the efforts that all the NGOs and all the actors have together is very difficult. Burkina Faso is working their mobile health strategy, and we were the only NGO invited at the table. We're not the only NGO who is doing mobile health in Burkina, so we had to bring people in. And this also is a big barrier, I think. Now, if we speak about the money and the costs, we are doing evaluation of costs, and I think one thing is maybe governments, they are afraid because when you start telling them what exactly it will cost and how you will have to scale up, it touches a lot of different sectors. So you will have to budget something at a district level, something at a national level. You will have to have a data warehouse. If they don't, you have to train people, transfer knowledge to make it sustainable and operational on the long term. And all these things, I think, are what maybe scare the governments to actually, adopt the technology. So it's not easy. I mean, it's possible, I think, but it's a process. It's difficult.
Yeah, I think we're learning the hard way that it's not just about the health economics, the utilization benefits and so on. It's also around capacity, resource mobilization, prioritization, oftentimes in the government, and the difficulty of implementing ICT systems into an environment where there is no ICT solutions built into that. Blake, just carrying on the concept of the business case or scalability, you spoke about the ecosystem. Just share with us your thoughts on how an ecosystem has the capacity to achieve economies of scale, volume-based discounting, bringing all of that into a single user interface application that, again, increases usability and utilization, but more fundamentally drives down the economies of scale for those aggregated services.
Sure, and actually I think that when we think about ecosystem, it's sort of a term that you kind of hear said a lot at conferences, but I actually prefer to kind of think of the ecosystem as a set of stakeholders, a set of partners. And so where we've found success both within the realm of sort of the development work, more or less, that Wireless Reach, my team, does, is through leveraging the expertise of each collaborating organization. So we've talked a lot about the mismatch between the development of the technology and sort of the research cycle. So I think that's one piece of it. It involves really deep engagement with not just sort of the technology providers, the software developers, the operators, but also sort of the academic community, the government, the NGO community. There really has to be sort of a very tactical approach there. And so, for example, within Wireless Reach, we over the years, we've sort of realized the real need to have this very frequent dialogue, really, about how do we begin to think about really more agile research mechanisms around the implementation so that we can get the evidence out there quicker to match up to the business need, to really push forward some of these implementations. And so, and then if you kind of think about it from just a business perspective purely, the ecosystem is, again, really important. And thinking through the incentive structures of each of the players in the space is sometimes a very complicated endeavor, but it's essential to really creating programs that are going to go to scale. So bringing the operators in from the very, very beginning, thinking through what the business model is, what the ARPU cost might be, thinking through what the revenue streams are, is really, really essential. And not just that, but also thinking about how that ties into sort of the political will that we've talked about, right? So thinking through what kinds of things are going to sort of motivate policymakers to sort of move the needle a little bit. And I think from our experience, taking things to scale, it's a very long-term endeavor. It's not going to match up necessarily with sort of quick investment. So you have to really take the long view of these sorts of strategies. So we've certainly seen some of the timing around the 4 or 5 year time frame from sort of research, proof of concept, finally to sort of get traction and then create scale. So that's sort of what I would say about that.
Thank you. We are short on time, as I said when we began. We'll have time for 3 questions. If I could see anyone that does have a question, if you could ask that now. While we wait for that, I'm going to just jump in there as well. And just on the business case, we're about to publish a piece in the next 2 weeks looking specifically at the Mum Connect solution. And we did the modeling across the different mobile channels, the USSD, IVR, SMS, and data-driven channels. We actually found that we could effectively reduce the operational costs by a massive 2/3 by considering a blended approach or a data-driven approach as opposed to a USSD channel distribution at the moment. That's being used. But what that fundamentally requires is a value creation for all of the different partners.
Right.
And at the moment, there isn't significant value proposition, which is why there are no commitments on the USSD side. If there is a commitment to move towards a blended approach, there are very strong commitments of zero rating, certain services and discounting and leveraging PR and marketing. But a critical term that was then introduced to all of this is not so much the PPP model, but very specifically towards healthcare and even more so within mHealth is the notion of multi-sectoral partnerships. And we're very quickly realizing that in order to create the scale and the sustainability, we need multi-sectoral partnerships. Not simply public-private partnerships, but multi-sectoral partnerships.
If I may just make one while we're waiting for the mic to be distributed, I think that there is, though, coming back to your regulatory issue, I think, no, it's a critical...
Wasn't going to let me get away from that.
No, there's a critical caveat that has to be brought to the forefront, and that's the regulatory bodies that these countries look to are UNICEF and WHO. And UNICEF has very clear general technical provisions for medical devices that are clearly outlined, providing guidance for manufacturers and producers of point-of-care and medical devices, which I think should guide innovators in the mHealth space to as first starting build to standards. The other reality that's going to be essential for all of us to recognize is WHO's push towards health intervention and technology assessment, HTA boards, that they are strongly encouraging member states to adopt. And the HTA process is a very systematic evaluation that covers everything from the efficacy of the device all the way through the social, economic, and organizational aspects of that technology. And so countries, member states are going to be reflecting on their procurement process of HTAs using these criteria in order to back up their decisions with a certain process. And so I don't think mobile technologies are going to be able to circumvent the HTA process. So it behooves us to really look into that as a set of benchmarks that we're going to be held accountable to.
Sure. So I think just in response to that, they, if again we look at medical device industry, we're looking at more influence from FDA and CE as the benchmark regulatory authorities rather than the WHO and others who have tried for a very long time to institute the HTA with moderate degree of success within medical device industry. So we hope that we'll have more success within mHealth, but
for government procurements, though, if they're not sort of pre-qualified or on UNICEF's procurement list, these things are going to be hard to acquire. So that might be sort of a targeted advocacy that, we've been in the public health technology space for some time, but even when we transition into mobile, the issue of getting our technologies listed on the UNICEF procurement list is not an obvious roadmap. So I think that's something for us to think about.
yeah. Any comments from the panelists on that specifically?
Maybe I can add just one thing with regulations. We are also confronted with all the data privacy problems and issues because Burkina, for example, has not really very strong laws about this, and we're speaking about collecting data on patients, and the regulation there is very, very, very poor. They don't have the infrastructure to host this data necessarily. Actually, they don't have any patient records so far, electronic patient records so far of that scale. So it's a new thing, and so when we come in with new technology, also creates, you respond to certain problems, but also you create more needs somehow. And this we have also to address. And when we're speaking of laws, that's again a very long process that we should also take into account when we start these sort of things.
Are there any questions from the audience at this stage? Yeah, one question in the front. Maybe while we just wait for the mic to come to the front. Patty, a huge issue with point of cares and all of these system software solutions is the capacity issue, and something that you focus very specifically on. Can you help us, just give us a framework of the capacity considerations when introducing something like this? What are the time frames we should be thinking of? What are the costs of it? What are the implications from a resourcing perspective?
Sure. So, capacity, it's such a sort of big area. And I think what we're starting to see is that we're moving into sort of a digital health age with health workers who were probably trained, most of them, for the first time 30 or 40 years ago and have not received refresher or new training, et cetera. So there's multiple layers of capacity that actually needs to be built within the health system. And I think one area that a lot of countries are starting to look at, and this came up in a workshop that we hosted a couple of weeks ago in Nigeria, is can we begin with the curricula of the health workers and really revamping the medical curriculum, the nursing curriculum, the community health worker trainings, so that from the outset you have health workers who are familiar with technology, who really know how to navigate the use of these types of technologies, and then have them become part and parcel of what they do. And sometimes, depending on the technology, it can be something that is, sometimes we're pleasantly surprised by how quickly health workers pick them up, and sometimes, you actually have to go back to the very basics of how you use, whether it's a tablet or a computer or a cell phone, to get people really up to speed on this. I think the other area of capacity that is really challenging is also in the decision making, as well as the administration and supervisory support for the use of technology within the health system. So you don't have necessarily cadres of people within either ministries of health or departments of health and district health offices that really have a good grasp on how do you manage these things, how do you integrate it into the workflow. And so I think there's a lot of work that needs to be done to really systematically think about how we build this. And it's not going to be, technology is not going away, so it's something that we really have to kind of take on and work our way through.
And there's a big conversation at the moment around how we can use the device itself to do the training, isn't there? Mm-hmm. Also, a good segue into the next session, which is around mobile money, the incentives around what we can create on the mobile environment. Let's go to the question on the floor.
Hi, this is Ed Bunker from JPIGO and JHU. It's been incredible to hear the panel discuss this morning. It provides a nice historical snapshot of where we are in 2014. And it's interesting to compare, say, what the conversation would have been 5 or 6 years ago. And so that's kind of the question I wanted to pose to the panel is where are we on this kind of historical timeline of mHealth or D-Health, I think as Patty kind of referred to. Probably everyone on the panel and probably a lot of people in the audience years ago used to use the term Wild West to refer to kind of the state of mHealth. Anyone want to raise their hand if they've used that term before? Okay, so I think you know what we're talking about. So the question is, where are we? And I jotted down some notes thinking, well, it's maybe no longer the Wild West, but using the image of the kind of American Western, it seems as if maybe the sheriff is in town now. We have a sheriff, and we have a railroad, and maybe we have a school teacher. But I'm wondering if the panelists are seeing something else, if we want to use the analogy of the American Western to kind of describe where we are, because I think it would be helpful to convey to people kind of where we are today in 2014.
So the desperados are on the outskirts of town, is that the...
Somebody want to answer to that?
I can. So I think we're in a new age of like law and order. So building on your your analogy, where there are certain principles that are now starting to really govern how we engage in the use of technology. So, we started with the Green Tree principles. We now have the 9 principles for digital development, which if you haven't seen them, take a look at them. And I think everyone's starting to play much nicer together within the sandbox. There's a lot less competition. There's a lot more collaboration, convergence of technologies. And so, and there are some rules and policies that are now being put into place to start to make sense, whether it's standards or, privacy and security laws that are helping us to actually sort of ring fence in some ways the use of different types of technologies and approach them in a much more sensible way. So there's a huge maturity in terms of how this work is playing itself out, particularly at the country level. Like I find sometimes at these global conferences that sometimes we're having one conversation, and then you go to the country level and you actually see what's happening in the countries, and there's sort of a bit of a disconnect between some of the conversations that we're having and what's actually happening on the ground.
And I'll just kind of echo Patty's point. I think that that the point about evolving from a very sort of fragmented marketplace to a much more coherent industry is really sort of what we're seeing. So we're seeing much more openness in software platforms, sort of open ecosystems where you can sort of mix and match devices and they sort of all play together nicely. We've seen some nice evolution with the technology, with some more stable Bluetooth stacks and so on. So I do think that we're seeing that evolution, and even from sort of a policy perspective, we have programs, like I said, in nearly 40 countries. So looking at the recognition of the importance of not just sort of the frontline health worker, but enabling that key linchpin of the healthcare service delivery system with technology is becoming more and more of a priority. ASHAs in India, promotoras in Mexico, we're just seeing it everywhere. So I would definitely agree that we're seeing it. But it's not. We're not quite commercial mainstream yet. But I think we're just on that tipping point. So
maybe I can add a little thing, and then I can conclude. He's the bigger brother. I don't really know exactly where we are. Maybe because I'm relatively young still in this field. But my question on this is, maybe 10 years ago we had to prove that health was something that could work. I think we've proven this. And we've proven this even if we had a lot of limitations, a lot of constraints in terms of infrastructure, etc. Now a lot of countries are going for this. It's clear, there is a clear will, and it's accepted that we should go on that direction. But for me now, it's how do we go much further than that, considering still some very strong constraints on connectivity, for example. And for me, and again I speak from my painful experience in Burkina, that we don't have internet. It's very difficult to get, even in the cities. There is no electricity, and so now, and to overcome these constraints, it's going to take again a lot of time. So how are we going to develop much further the field when we have such basic constraints? We've talked a lot, I think, yesterday about very nice initiatives that work perfectly, but one of the things they had in common is that they were maybe in more connected settings. In my case, connectivity is a big problem, and we have to always develop technology considering we have connectivity, but then also plan, have a backup plan for what happens if we cannot push the data. Because if you don't push the data, if it's not available, then a big part of the point of having the technology sometimes disappears. As I said, if you cannot use the data to retrofeed or to feed back your health workers, then it's sort of a pity. You lose a big potential of the technology. So I will be actually very curious to know, like, how are we going to develop new technologies that can maybe find workarounds to these constraints.
So I think this has been a really great panel. Thank you for moderating, and thanks to the organizers for hosting it. I agree with what has just been said. We've seen, dramatic, in a very short period of time, we've seen real eras in the growth of mHealth. And I think to some extent we've learned from the lessons of the e-health adventure that came before us. There's been a lot of commentary and even at the country level burnout from the overhyped promises of the e-health revolution. And so I think the onus is on us as new innovators in the mHealth space and the digital health space to come to learn from that experience and to temper our enthusiasm with balanced scientific and ecosystem awareness. We've gone from this era of discordant innovation through an era of parallel play, where we recognize that others exist and we work together, to now we are seeing best of breed and national level initiatives take the stage. And so, as we mentioned yesterday, many of us in the room are impatient optimists. We want to see things move fast. And just before the panel started, we were talking with Craig about the vitamin C scurvy story and how it took 200 years for the British Navy to adopt an evidence-based strategy to prevent a major cause of morbidity and mortality in British soldiers, seamen. But despite the availability of evidence and a very simple strategy, that adoption took many, many decades, centuries in fact. And other simpler technologies like vitamin A have taken several decades to get into practice, even though we're talking about an intervention that costs a penny to actually reduce mortality. So public health is not an overnight science. It takes time, and I think we will have to reconcile the speed of our enthusiasm with the pace at which human beings change.
Thanks, Lane. So just in closing, no shortage of innovative technologies. I think what we are seeing is some fundamental infrastructure and integration issues, as you've mentioned, around evidence, interoperability, standardization, needs to be participatory in its design, needs to be equitable, sustainable, and integrated. So by no means the silver bullet, the technology, but we are looking at the next evolution within the Wild West, as we would call it, is really to integrate those technologies and those services into the health system in a far more meaningful way. So, as with all panels, we never really have enough to get into the meat, never really have enough time to get into the meat of the conversation. So would encourage you to please ask your questions when we break, and if you would please join me in just thanking our panelists for a very informative discussion. Thank you.